Hi, I'm Neha Shaik, and I'm excited to talk to you today about AI for health equity in disasters. I'm a rising junior at Cupertino High School in the Bay Area. I'm a research intern working on developing computational artificial intelligence tools to diagnose cervical cancer early. In addition, I also do independent research on climate health equity. As a Girl Scout, I'm working on my Gold Award to encourage more girls to be involved in STEM, especially AI. I'm also a Technovation Student Ambassador, where I guide girls through coding projects for social good and a member of the Stanford Neuroscience Journal Club. In the future, I hope to be working at the intersection of computer science and medicine. Climate change is increasing both the frequency and severity of natural disasters, such as wildfires and floods, triggering significant health crises worldwide. These disasters can cause infectious diseases to spread and worsen existing respiratory conditions like asthma. Survivors face long-term impacts, including limited healthcare from overwhelmed hospitals, trauma, and hunger. These compounding effects are increasingly recognized as global health crises. The health impacts of climate change continue to worsen, disproportionately affecting low-income and marginalized communities. These groups often live in high-risk areas and are under-prioritized, lacking necessary resources. Many already lack strong healthcare infrastructure before disaster strikes, worsening outcomes when it does. Addressing these challenges requires building equity into our disaster response and healthcare systems. Over the past few years, I developed and published a paper on an artificial intelligence solution to address the challenge of equitable resource allocation, specifically in the context of wildfires. Wildfires cause huge amounts of devastation, with more than 4 million burned acres and 50,000 wildfire incidents every year, affecting vulnerable communities unequally. The number of people who are highly socially vulnerable and exposed to fire has significantly increased in 2011 to 2021 versus the decade prior. So it is critical not only to model wildfire risk accurately, but also to identify socially vulnerable areas that have a high risk of wildfire. In my research, I used machine learning to predict wildfire spread and combined it with the Social Vulnerability Index, helping identify areas which are in most need of support during wildfires. Social vulnerability is defined as the extent of a community's ability to recover in the event of disasters like wildfires. The Centers for Disease Control and Prevention has developed a Social Vulnerability Index, which includes several factors. This index considers health-related factors in a community, such as the number of people with disabilities who may have difficulty evacuating during wildfires. It includes people without any health insurance who may be unable to afford emergency medical care. It also takes into consideration the number of older adults above the age of 65 who may face challenges due to pre-existing health conditions or mobility issues. In addition, it includes the number of children who may be more susceptible to illness. Furthermore, it considers other factors such as poverty and employment levels for each community. In order to assess both the wildfire risk and social vulnerability of a community together, I first developed a robust artificial intelligence model using meteorological data from NASA and NOAA that predicts wildfire intensity on a per-day basis. This heat map shows the wildfire intensity predictions for the entire USA. As I talked about earlier, vulnerable populations are disproportionately impacted by wildfires. So next, I integrated the AI model's wildfire intensity predictions with the CDC's Social Vulnerability Index. This generated a combined vulnerability risk heat map, that is, wildfire risk plus social vulnerability for each census tract across the country. These two maps highlight the impact and utility of my AI approach to aid allocation. While the first map shows areas with high wildfire risk, the second map identifies communities with both high wildfire risk and high social vulnerability. Now let's focus on two specific areas, areas A and B shown in the maps. In the first map, although both Tract A and B have high wildfire risk, the second map shows that Tract A has higher combined vulnerability than Tract B, and hence, Tract A will be impacted worse and will need more support than Tract B during wildfires. And Tract A is actually Merced County in California, which is regarded as one of the centers of poverty in the USA. And Tract B is Eureka County, Nevada, which is one of the wealthier counties. By providing this level of insight, my research enables emergency health responders, fire managers, and policymakers to plan where to allocate resources while considering special accommodations for vulnerable communities. For example, helping evacuate individuals with disabilities or ensuring that medical supplies are available for those who don't have health insurance. This is one solution of how to create health equity during natural disasters using AI. There are many other applications where AI can transform disaster response. AI can detect disease outbreaks like dengue early after disasters by analyzing real-time hospital and community data, helping public health teams respond quickly, especially in underserved areas. AI can support triage by quickly analyzing patient data, helping medical teams prioritize the most critical cases and guiding ambulances to the fastest routes. Additionally, AI-powered telemedicine can offer virtual care when hospitals are damaged or distant, supporting rural and low-income communities with remote medical appointments and mental health support. As the usages of AI continue to expand, it's important to consider how to use it responsibly and ethically. One major concern is fairness. If the data used to train an AI model is biased, the system can make unfair decisions. It's essential to check both the data and algorithms for bias before deploying AI solutions. Privacy is another concern, as AI often requires sensitive information like health records, which must be protected. Third, without having transparency and knowing how the AI is making decisions, it's hard to ensure accountability. It is important that AI systems are transparent to the people affected by their decisions. To summarize, climate change is fueling more intense natural disasters, which are rapidly becoming global health emergencies. These disasters damage hospitals, cause disease outbreaks, worsen mental health, and cut off access to clean air, water, and food. But not everyone is impacted equally. Vulnerable communities lacking access to strong healthcare and disaster response systems face the worst effects. To close these gaps, we need better, more equitable disaster response systems, and using AI is a valuable way to get there. We already know that AI can make a difference, but the challenge now is how to use it wisely and fairly to ensure that in moments of crisis, vulnerable communities aren't overlooked. I would like to thank the staff at the Global Health Leaders Conference and Johns Hopkins University for giving me this opportunity to speak. I'd also like to thank my listeners for spending the time to learn more about this important topic. Here are my references and my contact information if you have any questions. Thank you so much for listening to this presentation.